First of all, I would like to thank you for MMRTI or Atosaye for giving this chance. When I was in Ethiopia, everybody was concerned before I came here. What I mean, really, religious organizations, government organizations, everybody is talking about HIV/AIDS. And there are different kinds of teaching to prevent the people, like discussion, education, brochures distributed in different people, different places. So when I came here, I'm really just hear about HIV/AIDS when I come to Asahi office or somewhere who is working for HIV/AIDS program. But in my experience, no one is talking about HIV/AIDS. Even me, as I told you, I was concerned and working for HIV/AIDS to prevent. But nowadays, I just forget it, to tell you frankly. Even I'm thinking that HIV is not a big issue. I don't know why. The problem is everybody has information every time. If there is no information, people are just focusing on different things, not HIV. Especially in Ethiopia, if somebody is diagnosed by HIV/AIDS, maybe he can give us. I was working with people who live with HIV/AIDS. In my program, we invite the people who live with HIV/AIDS and they give their testimony, and everybody is very focused. And if somebody is a professional teaching, give a teaching, that's not just a value, that's not has a value. But a person who is living with HIV, he give his testimony, everybody is focused and just they can hear him. So I know there are so many people who live with HIV/AIDS here in our community, but no one exposed himself. No one is talking about HIV/AIDS. In my understanding, it's better to even the government, non-profit organizations give attention, or they have to look their direction, how they teach the people, how they reach the community. Like in faith-based organization, it's better to invite preachers together and give information, and they have to discuss together. They can reach so many people. The other one, if HIV is issue, it's better to people who live with HIV/AIDS like Daniel. They have to go to the community and give their testimony, their experience. It may just bring us change for our community. So again, I would like to say thank you, Atosaye. Thank you, Ato Solomon. Yeah, it's too hard, especially in our community, in our culture. So we have to encourage this kind of people. We have to support them. In our church, if you are a volunteer to give your testimony, it's open. You can stand in front of the people and give your experience. Everybody can listen here. If I say something, I always with them. Of course, they can accept what I'm telling them. But it's better to say something. If you say something, maybe the change will be fast. So we have to encourage this kind of people. This is what I want to say. Thank you.
May I add one thing about this? Hey, one of the reasons that I went out on public, disclose my HIVs, it's unheard of. It's just a new idea for our community. And when I was diagnosed, it was after I lived in the state 12 years. At least I have a okay understanding of the language, the culture, how it's handled on other community. Like disclosing about HIV, just about not only HIV. So then I just made that decision at the time by myself. In fact, I was not the only one on the family member. I have a brother I lost for HIV. Well, he happened to be in Ethiopia. Bad timing. I have another brother also in Europe. He survived. So then it was not so much about me. I already had the knowledge. I have a good chance of surviving because of those powerful medication. Then what? So the sad thing is, how do you go about the disclosing process? I mean, you just go quietly talk to church people, which I have done. They get scared. They get paranoid. Then you never hear back from them. Then it just non-stop. Then you just think that Washington D.C. is where the biggest Ethiopian concentration. You think that maybe most people say that we have most of our physician doctors, they live around this area. Then when I disclosed mine first, it was on Howard University. When we do that, maybe there was about 100 physicians. They came to that meeting. You never hear back from them after that meeting. How cold can you be? Not because you really went to medical school, you're a doctor. Still, you're stuck on that culture. Yeah, you went school to learn. Then you go over there and take your check, and after that, you don't want to do anything for your community. That's just our weakness. So, I mean, in fact, they were really, to be honest with you, they were really threatened, as if like I was there competing for the job. I was doing it for free, There is no money there. I'm not organization. But at least I live in the state. I have an access for medication for free. And I'm not going to starve. I get housing. That's about it. That's big. That's huge. That's what I need as an individual myself. I think most people in Africa don't have that. So I felt it's not so much for me to talk about HIV/AIDS. It's about bringing openness to our culture. Then I think when you talk about HIV, it's just sex, right? Then it's very taboo. Then once you really break that barrier, it kind of really make it easy for the other people to be open in different area. So now, if I want to add one thing, when we say about HIV, everybody's saying HIV. I think the information has to be, I think you've done a lot of work around STDI, sexuality in general. Like what is that? I mean, gonorrhea, yeah. Some people, they don't think that doesn't exist. So I think we have to have a different approach with health department and address it through the community, the media. There is a lot of complacency, not only in our community, in the general population at all. So I'll
just a few additional comments on stigma. I've talked to a couple of different kinds of service providers here in King County who have tried to get support groups organized for people who are living with HIV in the African community. And the story that I've heard several times is that those support groups don't work because the people who are affected with HIV don't even want to identify themselves to each other, because they're so afraid of how they're going to be received in the community, or that there will be information about their status that will be disclosed to other people outside of that group. And so I think that this is something that is really, I also want to give Solomon a lot of credit, because people who have HIV in the African community, many of them are very afraid. I've heard terrible stories about how people have been treated by others when they've disclosed their status because of the stigma. And so I think that it would be wonderful for people to come out and to have more people disclose their status, and I think it would bring more openness to it. But at the same time, I think the community needs to be willing to be receptive to that and to show their support so that people are not so afraid. People will not disclose their status if they feel like it's going to hurt them. And I've been doing interviews with people who have HIV who are from Africa for a while, and I ask people about their experiences with stigma from their family, from friends, from neighbors. There are a variety of questions from different people. And I had to add a question after all of those questions about stigma, because the questions are about how people perceive that they are being treated by other people because of their HIV status. But I had to add additional questions because so many of the people that I was interviewing haven't disclosed their status to anyone other than their medical provider. They're living with it by themselves. And so I think it would be a huge leap forward to have more people come out and share their experiences about living with HIV in this community. But I also think that that is a really difficult step, and that might be something that we can talk about more here, is how to make that more comfortable for people as we go forward.
One thing quickly I wanted out about that support group. I mean, it's wonderful, but it's not going to happen. It's not. I mean, it's not. To really get together HIV positive people to come talk in person, no. But I have proposed a support group online. How about that? Yeah, you have to build a nice website that costs, great deal of money. I don't know. I'm not a tech person. Yet I called for that years ago, to really find, a volunteer. Can't find one. Not only Seattle. I really put a lot of emphasis about community. Hey, can we do something for ourselves? At least can we really find somebody help us? Website, none. I think that's a great idea. I don't know if I can find support from county or some volunteer. I'm sure. If you can do that, then that's where you start. It can only be around Seattle area. You can do it nationwide, maybe worldwide. Is that just best way? Then once people they really get used to that, they have to see the benefit of disclosing. I think disclosing for African is just extremely difficult. So does for the other community also. It's not easy. I think I don't know, maybe not everybody disclose, So if you can really have that online support group, at least we can really talk about. The only thing they need is people, they call me from everywhere once they know HIV. Hey, can you help me? A partner. The loneliness is killing me, That's once they really get that, they're done. I mean, they're not even going to come around. So then what more can you do except setting an example? Now, okay, I'm HIV, I take my medication. This is what the HIV person look like. And you go on in your life. That's good. Then I'm just basically, I will go home and laugh. Okay, we do that one day meeting and done. Yeah, hey, I'm living. Stigma, rejection, Then what do you do? People, they don't really do that out of they don't like you or they're mad at you. They're afraid, They just don't want to hang out with you because they don't want to be labeled. Oh, you're hanging around for him a little bit more. Maybe you're HIV too, Then you cannot date. You can't even have a friend. You just lose everything. So on this kind of environment, it's just a fantasy for other people to really come around, to really come and disclose. So media play a very important role. One of the things that the community at large has to really understand, we're really doing that to ourselves. If you cannot really supportive, encouraging people to really disclose, what do they do? Just because you're HIV, that doesn't mean that your sex life is dead. Yeah, you really want to be loved. You really want to get into relation. Where do you go for the support? Yeah, I think most people, responsible, there are some. They just get angry. Yeah, I take medications. There is nothing wrong with me, I deserve with somebody. Where do you go there? See, we don't even really go around that area to discuss that. So being HIV is nothing like, okay, now you have it, you take medication, done. That's where we are. So it's kind of really K-22 situation. So that's why we really need to discuss and show for our people there is advantage to go get tested. Hey, once you get tested, you're not going to be alone. You get medication. By doing that, we help ourselves. It really benefit us. But we just don't see that. It's just all about ourselves. It's just culture. How we will really come out of that. I've done my part now. I'm one person. Then every time people they're asking me, hey, why don't you do this? I mean, you hear like 10,000 idea. Look, I'm just one person. I'm not even really getting paid to do that. I'm able to do that because I live in the state. At least I get the basics. So, yeah, talking about it is good. So now, if I want to say one last thing now, December 1, World AIDS Day, unless you really took an initiative, nobody even remember. This is a disease that we lost a brother, sister. If there was one day that to really take a time out to remember a person with HIV that day. For years now, after I've done all that, I don't even get a phone call now. Nobody really pay attention. One day. So just that we really caught up in our life. Most people worked 2 jobs, help family. Just like my friend say, a lot of issues. So just because we have that doesn't mean that we don't have to do our work about HIV/AIDS. So that's where we are.
Well, I am not a medical doctor, but I know that all of the HIV tests that are out there have different levels of sensitivity and specificity. So that means if a person is really positive or really negative, the test does better or worse at detecting the antibodies in their blood. And so there are some tests out there that are not as good as others, and they will return false negative or false positives. And there are tests that will give some amount of false negatives. So from a public health perspective, when we are supporting people to do prevention work and do HIV testing work, we always try to make sure that people are using the best tests so that we're not giving people incorrect results. It does happen from time to time, but hopefully as the tests get better and better, that won't happen as frequently anymore.
Yeah, I want to just reiterate what I have said or what I meant to say or what people have said, which is, I think, and I'm trying also to respond to your question, which is why our community are late diagnosis out there. So what it comes down to is, in my opinion, since this kind of a continuum of services with this HIV, whether it is empowering and getting that piece inside you to take you to a testing, and knowing that there is a quick testing because of this disease, the unique thing is, when I compare to other diseases, for example, hepatitis B, which needs a blood draw, a cord blood, which takes about a lot of volume of blood. But this is, whether it is saliva or drop of blood or any other tissue, any other fluid, could be tested and find out your status in a matter of seconds or minutes. So not knowing that, that's a real challenge. What makes us to, for example, if we have a free HIV testing next door, how many of us are going to go there and do that testing? Do we know that? Not forget about the rest of the community, even inside our own selves, the leaders. There was a time that Solomon, who is not here, with program CMHC, so Community of Health Services, they were doing at a health fair. And then I wanted to document myself taking the blood, donating and testing, and that quick. And then it didn't work out well because I couldn't make it because of confidentiality, other things. But I did the testing, and there's other community members who could not dare to come to that room confidentially and do that little testing and find out their status. So we have that giant elephant in the room. So we have to find a solution for that. Then when we get that testing, whether even if you are diagnosed with HIV, and then you have early diagnosis and you have a solution for it. So that fear exists. So care is available. The communities are blinded, folded because of not knowing and because the services are there. And then that cultural fear, stigma, all those things exist. And then that's the time that education comes to play. And then there's a times that we don't have treatment. Antiretroviral virus therapy was not available a long time back, but now it is there. If you need, it is very expensive, but it's available. But who wants to take it? The social support. Do other communities are doing this thing? Other Americans or other male having sex with other men, do they have support groups? Are they doing? How are they doing? Why not us? So we have to ask ourselves, and why have to take advantage of this opportunity. So if we do the right thing, following that continuum of service and care, I think we will have, even those living with HIV, the viral loads will be depressed and suppressed, and they live a normal life. But education plays a big role. That's why even people who feel themselves they are liberal and educated and empowered, even for themselves, they are not willing to do and be an example for the community. So yeah, December 1st, we have to be happy and remembering the people who died for this disease. And then we are targeting a zero transmission in our community. Zero transmission, not reducing only, zero transmission for this East African. And also we have to have those people living HIV to live longer life for our people. Thank you.
Actually, when I see this number, again, it's really very scary number, especially for Ethiopian and the Kenyan. Maybe I'm trying to give it a reason. Maybe, Ethiopian community in Seattle are larger than any other community, but I think Somalian are comparably large in Seattle area, but the number is very, very significant. I mean, it's really very big difference. So I have been working with Ethiopian community once every while, and one thing I understand is that most of us Ethiopian us population in Seattle of any ethnic background are really very, very isolated, I think. Isolation in terms of language, culture, even though a lot of people actually physically present here in America, they don't have a lot of access for information. I believe that everybody knows facts about HIV, how it's transmit, because this is a big issue in Ethiopia once, and everybody has learned how it's transmit and how it comes. Everybody knows about facts about HIV. Maybe it is forgotten, like when you don't raise issues, when you don't talk about things, you always forget about it. And we need reminders, so media is very important. Just stressing, media is very important. Media has to reminding, these diseases still exist in America. Most people, when they come to America, they have to go through the tests for HIV, and if they are not, I don't know if it still exists, that is a violation of, certain law. Might not more exist now, but I know that before I come, like 5 years, 6 years ago, I know that before people come, if they are immigrant into United States as a permanent residents, they have to go through they have to go through test, and only if they are HIV free they come to America, and that maybe affect a lot of Ethiopian. Maybe they think everyone come to America have no HIV. So I think we have to be remind our community. Most importantly, really Ethiopian community. This is a large number. This is like a fire, really, next door. So we have to. That's what I'm trying to say.
And in fact, he had been incarcerated for 10 years. He used to be an army, so he had been in jail for 10 years when he released. So, and then he was working with what they call Bridge, another non-profit organization. And when they get that result, the guy became devastated, and he said, "This is impossible." So Bridge said, "Well, that was a serious hospital that have tested this guy and said, you have 3 months to live. The exposure is all over you. You have only 3 more months to live." And the guy was really shocked. He's young man. Then they sent him to a different test place, and the other place said that you are negative. So the amount of, pressure that it put to the entire family. I'm married to his sister, so the mom, the brothers, and everybody in the family, we were shocked. And then all of a sudden, this results, his sister went with him. They did the test. They did the test, and they said, "You had never had AIDS. Who told you this?" So those kind of things really discourage many people for that kind of aspects. I wonder how we are going to eliminate those misdiagnoses it is a perception that really doesn't help anybody. So how can that happen? I don't know how that happened, but I want to know at least. I didn't have any clue how that can happen. Such a vital mistake.
Well, I am not a medical doctor, but I know that all of the HIV tests that are out there have different levels of sensitivity and specificity. So that means if a person is really positive or really negative, the test does better or worse at detecting the antibodies in their blood. And so there are some tests out there that are not as good as others, and they will return false negative or false positives. And there are tests that will give some amount of false negatives. So from a public health perspective, when we are supporting people to do prevention work and do HIV testing work, we always try to make sure that people are using the best tests so that we're not giving people incorrect results. It does happen from time to time, but hopefully as the tests get better and better, that won't happen as frequently anymore. Swedish, I would expect better from that. Unless it was some kind of error possibly as well. I don't.
Yeah, I mean, that's sensitivity and specificity. That's the two area. I mean, you can always think about it, but I mean, it's very rare that you will give that test and then all of a sudden another test taken and they say you are negative, especially when the viral load is so high to the point like you've been diagnosed it's AIDS. I mean, that was.
You're all right. There are varying degrees of sensitivity and specificity with certain tests, and different community-based organizations and different organizations use different types of tests themselves. So it all depends upon the individual as to which test probably is most appropriate for them. There are things like the home test kit out there that does have a lower sensitive assay, and it's an oral mucosal transudate test, so it's not a saliva test. Okay. There are some other tests that are 1 minute assay tests that are slightly higher than those home test kits, okay. And those are usually finger pricks, so they're done by a blood draw, right. By capillary draw. Capillary. So. Absolutely, and those have a higher sensitive, right.
A lot of people don't know what capillary is, they don't even know it's
right.
So just break it down.
So where we go from here is, I think, the last question you had, and we had this Ethiopian Health Council that we started 5 years ago. Then it grows a little bit slowly. Then we'll finally see the power, so we give it to the Ethiopian community. Now they're doing great things with them, and I think just to support this day. We should pledge to do something about it. And one thing that Solomon brought is, I think, anonymous website networking, especially in our community, is crucial. And everybody is now using new technology websites and also mobile apps. So I think we can start working with the public health or UDAB to have that small things that we can start.
So we have come for too long to give up now. Now we're about to cross the finish line. In this time we've seen so much of God's word. If you move with me, I'm sure you'll see. As we reminisce on this few years, see, I see great joys. I also see success ahead, because in us we have a will. As we tread the path, we're gonna win, despite what this narrow path has. Through the storms, the passing seas, yes, we will come out feeling great. We'll never give up and never give in. See, faith is all we need to fight, and we're gonna win. As we tread the path, we're gonna win.